My name is Dan McCarthy. I'm the Arizona coordinator for the Western Regional Alliance for Pediatric Emergency Management. And my co host for today is Irene Navis. Irene?
Hi, everyone. Thank you for being here this afternoon. I'm Irene Navis. I'm the Nevada coordinator for RAPM and the domain manager for CBURN for PPN and for RAPM as well. Welcome, everyone.
The content presented here and throughout the presentations is out of the authors and does not necessarily represent the official views nor an endorsement by ASPR, IRSA, HHS, or the U.S. government. They just fund us. So today's purpose of today's workshop, first off, is to provide pediatric-focused content for healthcare facilities, coalitions, and community partners to include in your chemical response plans, and provide pediatric-focused resources and templates for inclusion in those plans also. Objectives for today, again, providing your organizations with an overview of pediatric considerations, identifying gaps in capabilities and capacities, promoting plan and annex alignment from facility to regional levels to your coalitions and the like, and then also to further building relationships between RAP and PPN and those of you that we can provide assistance to, and also within your communities. So the agenda for today, we're doing a little bit of welcome. The topics are decontamination, safety and control measures, patient care and management, antidote and countermeasures, special considerations, and then we'll do a little wrap up at the end. Throw it over to Irene to talk about the different organizations in which we're connected with that are providing the workshop.
Thank you, David. First, I'd like to start with the Pediatric Pandemic Network, which has been in existence a couple of years now. You see on the map there the 10 hub hospitals that are involved in the PPN. And the aim of the PPN is to empower healthcare systems and communities across the nation to provide high quality, equitable care to children every day and in crisis. And what is RAPM? Western Regional Alliance for Pediatric Emergency Management. It's one of the designated ASPR Pediatric Centers of Excellence. We serve 15 million children in the West in Region 8, Region 9, and Region 10, including states and our territories. This effort is led by UCSF Benioff Children's Hospital in Oakland, and it is a network of pediatric hospitals and academic institutions all working together throughout the West to accomplish our goals. The lead PI and support team and state coordinators all work together to lead 200 or so active participants throughout all of the work that we are accomplishing. And we support around 60 healthcare coalitions throughout the Western states that are involved in RAPM. And we also have a huge cadre of pediatric and emergency management subject matter experts that have been involved in response and recovery efforts to various disasters over the last several years. And the other ASPR Pediatric Centers of Excellence, Region 5 for Kids has also been in existence for several years, and it is led by Rainbow Babies and Children's Hospital in Ohio. It includes 10 pediatric centers, and they serve nearly 7 million kids in the Midwest area. And then the Gulf 7 is a newer center of excellence in existence for about a year or so. The 7 Pediatric Disaster Network, led by Texas Children's Hospital and Baylor College of Medicine, supporting pediatric response in Texas, Louisiana, Mississippi, Alabama, Georgia, Florida, and Puerto Rico. And of course, we can't forget the EMSC Innovation Improvement Center, the EIIC, sponsors and implementers of the National Pediatric Readiness Project and many other worthwhile endeavors throughout every state in the United States. And our efforts, of course, are focused in the Western states. Thank you so much. And David mentioned that we're setting the stage for today. So we're not having a strict adherence to this scenario, but it was just to form a framework around the discussions that we're going to have today and the presentations that you'll be seeing from our subject matter experts. And also it's to set the stage for future tabletop exercises that we hope to accomplish through the various hubs and PPN. And so the same scenario and framework will be used to develop those virtual tabletop exercises. And so we ask for you to just kind of follow along and not strictly adhere in your conversations, but make sure that we at least hit these key points in our discussions. So freight train derailment outside of a metropolitan area, unnamed, mix of freight, including liquid and solid hazardous materials. It occurs at a rail crossing where a school bus carrying children has stopped, and it's close by low-income housing, a nursing home, homeless encampments, an elementary school, a high school, and a daycare center. Firefighters, EMS, and police arrive at the scene within minutes, and smoke and liquid are emitting from some of the rail cars. First responders and others are experiencing breathing issues and skin irritation, and it goes on from there.